October 1st is when I can officially discuss the new different plan designs that are going to be available not only through Coventry, but Essence and United Healthcare companies offering the Medicare Advantage plans or the prescription drug plans. But Center for Medicare Services puts a ban on discussing new product until October 1st.
Right, Aaron. And now, you have assisted over 1,000 people here in the city.
And growing.
And growing in terms of helping them secure their coverage. Why don't you talk about, if you would, the process for all of our listeners who have become clients?
Sure.
What are you going to do for them?
So everyone, if you're hearing my voice and you're a current client of ours using a Medicare Advantage plan, what we do every year is send out a comparison between for example, this year we'll send out a 2017 versus 2018 benefits comparison for you. So you can take a quick look and see, hey, am I comfortable with the changes that are being made? If you're comfortable and nothing significantly changed in your health or prescriptions, then you can say, hey, I'm going to let it ride. And it's going to automatically renew for you with the new benefit design beginning January 1st.
And for those people that have selected the Medicare HMO product,
yes,
they continue to pay zero.
That is correct. They'll continue to pay zero. The nice thing is that in the Missouri and Illinois area, since the Reagan administration is when these Medicare Advantage plans were originally created, the HMOs have been zero and they have stayed zero. I can't say if they'll continue to be zero, but there's a good probability that moving forward, you will see the same premium number with slightly different benefits. For those individuals who have supplemental plans, if you're still comfortable paying that monthly premium and you don't want to make any changes, you cannot switch supplements during open enrollment. So the
base plan.
Exactly, those lettered policies, F, G, L, K, if you possibly have one of those are not subject to open enrollment. But if you have a prescription drug plan that is subject to open enrollment, you can
Part
make changes
D, right?
there. Exactly. Or you can make the decision if you've already been enrolled in Medicare and you say, hey, every single month I'm paying this premium and I'm not seeing the doctor. Maybe I want to take a look at what this Medicare Advantage thing is all about. You have the opportunity to review your coverage during open enrollment. You can switch to a Medicare Advantage plan, no medical underwriting. It'll become effective January 1st. And so that's really the time to take a look at what those plan comparisons are. Because you'll be able to make that switch then. And then for all individuals that are enrolling for the first time in Medicare, you're still able to access your effective date whenever it should have begun. So, if you have a November 1st birthday, you still choose a 2017 plan. Generally, it'll roll into 2018. You'll still get that November 1st effective date.
Where some of the networks, I know United's and Coventry's are very broad in terms of their coverage of physicians, participating physicians. And I also know that, and we've discussed this, is that if there were significant plan changes, especially in the HMO area for Medicare Advantage, that made sense for our clients to make switches, we'd be switching them.
Absolutely.
Or at least recommending they consider.
Yes, we do not feel the need to churn our clients' plans unless it truly makes sense for them. There are plenty of situations especially with the prescription drug plans, where that nice average annual plan changes companies. So this year we really gravitated towards the United Healthcare policy that used Walgreens as their primary preferred pharmacy. Last year it was a different policy, and this upcoming year it might be different as well. So it makes sense to definitely check that prescription drug policy. But the nice thing about Medicare Advantage plans is that over the past several years, even going back to before I joined the firm, to the past 10 years, there's been nice benefit stability, which means you are going to see some changes to your Medicare benefits. In terms of like what your copay is to the primary, what is to the specialist, what your maximum out of pocket is, but you do not see significant wild swings in terms of what your benefits are. So if it does make sense, because their network changes last year, United Healthcare dropped quite a few BJC primary care doctors and dermatologists. If we had clients that were utilizing those providers, we said, maybe it makes sense to look at Coventry or Essence. But if things stay relatively stable, people are happy, it doesn't make sense to switch companies all around unless you have inclination, you're aggravated, you don't like the yellow color on the Coventry card, you want blue with United, then it's the time to make a
Well,
switch.
and I think what's important is offering this part as a part of our game plan, helping those folks uh, deal with their healthcare issues, is that when you're done with your analysis, we really can tell them based on how you're currently spending and consuming healthcare, what your real out-of-pocket costs are going to be.
Exactly. We can get very close to what your expenses are going to be, especially on a fixed side. You're taking certain maintenance medications. They've been relatively stable. You're going to continue to fill them at the same rate. We can pinpoint within several $100s of what your annual prescription drug expense is going to be. We can even show you, because many people on Medicare,
how many doctor's visits you have.
Exactly. And also many people at aging into Medicare or on Medicare are very familiar with the donut hole. We can discuss, hey, we know that at the beginning of the year, your prescriptions are going to be X dollars. They're going to increase once you hit the donut hole, and then you'll see them decrease again once you've moved through the donut hole. So we can really talk about monthly expenses with people that it affects.
Well, again, I think it's important is at the end of the day with your analysis, we're really able to define how much they're spending. And for most folks, though, they probably are going to find that they're going to be spending either the same,
or less.
Real out of pocket, or less.
The nice thing about living in Missouri and Illinois is that many people have had access to excellent health plans because we have several very large employers that have had generous plans available to them. And not only are those plans generous, but companies contribute a certain amount towards their premium. So for those individuals, we might see some cost shifting in terms of the premium goes up slightly or a little bit more than they were anticipating, but the out-of-pocket expenses can decrease. Or for others who have retired early and they're on individual health insurance, they can see a drastic decrease in not only their premium expense, but their out-of-pocket expense.
Well, that's great. And again, Aaron, thanks so much for that input today. If you do have questions, if you're getting ready to mature, grow up, be eligible for Medicare, age into, thank you, into Medicare, you know what to do. Pick up the phone, give Aaron a call, 314-863-0008, or send her an email, aaron@jblfinancial.com. And what's so cool is that this whole process in terms of the healthcare also is really linked also with the Social Security process.
That is true because Social Security and Medicare are linked but not tied together. So you access your Medicare benefits through Social Security. You can also pay your Medicare through Social Security if you're enrolled, but you don't.
And old enough.
Exactly, but you don't necessarily have to because you can elect Social Security at 62. You don't have access to Medicare until 65.